Good afternoon. I'm here to let you know about going on to Medicare. If you have straight Medicare, there's one of my friends had straight Medicare and he had no idea what how vulnerable he was. He could have lost absolutely everything if he'd had a heart attack or fallen down. He would have had to pay 20% of all the bills, and he could have lost a whole year's of income. And thankfully, my friend had enough money that he would have survived possibly, but it would have lost him a whole annual income for a whole year to pay for that because he had straight Medicare. He didn't have anything else. And had he fallen down and broke his hip or had a heart attack, it would have cost him 20% of all the bills. That's a lot of money. For a doctor's visit, that's like nothing on 20% of a doctor's visit. Anybody could probably afford that, but for something like a heart attack or a stroke, or having to have surgery on a broken hip, that's a whole different story. We're talking thousands and thousands and thousands of dollars. So if you just have straight Medicare, that's good. A lot of people say, well, I'm retiring now and i have uh, I have Medicare, so I have free health insurance. Well, yeah, if you worked 40 quarters, you do have free health insurance through Medicare, or if you're married to somebody that provided that for you. However, if you only have straight Medicare, you're still responsible for 20% of the bills. So I'm here to let you know about that because he didn't know, and he was well over 65 years old. Isn't that sad? That's really sad. And another thing that's really sad is he didn't even have Part D, and so they're charging him now right around $40 a month. At least that was what they were charging him in 2019. So he was being charged a lifetime late enrollment penalty for Part B. I'm sorry, Part D. He was enrolled in Part B, but he wasn't enrolled in Part D. So now that he went on to a Medicare Advantage plan, now he's billed every single month when nobody else is. That anybody that enrolled in Part D before the penalty starts, which is 3 months after you turn 65, your penalty begins. That's for Part D and for Part B. So both penalties begin 3 months after you turn 65 years old. The only way that that Part B premium late enrollment penalty can be waived if you've already turned 65 is if you are covered with qualified uh, employer coverage. So then you have 8 months until once you've lost your employment coverage, you have 8 months to enroll into the Part B and Part D before you receive those penalties. So it's a little bit different for people who are still working and they have employment coverage that's qualified. So, but they still have to enroll within 8 months after they lose their employment coverage. So you want to avoid those lifetime late enrollment penalties, and you also want to make sure that you get enrolled into some type of Medicare Advantage plan or Medicare supplement plan to help offset those expenses of the late enrollment penalties and the medical bills. You don't want to be responsible for 20% of high medical bills. So make sure you get that taken care of and get yourself covered so that you're not vulnerable. That's all we have for today. Oh, one more thing. Self enrolling is agentless. So that's what some people call it, agentless enrollment. And agents are supposed to be able to get credit for those enrollments, and most of them do. So um, it what it does is it helps protect your identity because insurance agents are required by law to be compliant and to hold all your information, all your data of your name, your birthday, your Medicare number, and all that everything about you has to be contained in a locked file cabinet for 10 years. So nobody knows that except for insurance agents. But if people in the general public knew that, they would oppose it completely. Nobody wants anybody holding their private data in a file cabinet for 10 years. It's horrible. And so, but if you want to protect your identity, then you can do so by self-enrolling, and you don't have to give the agent any of your information. And you're on the only people that will get your information is it goes straight to the carrier, and that's a little bit safer if you ask me. And then it'll also protect you from anything that might be floating out there. Like I've heard a lot about monkeypox and COVID. Well, we all have had been touched by COVID, I'm sure. But now they're saying monkeypox is out there. Well, if you want to protect yourself from all that, then self-enrollment would be one way to help. It'll also protect you from inclement weather. A lot of my business is in the northeastern part of the state. I have uh, my license is in Ohio, and I have a license in Michigan and South Carolina, and in Florida. They get hurricanes and they get snowstorms in the middle of AEP and OEP. It happened last year during AEP. Florida was flooded and had terrible storms, and so that was right during AEP. And then one year, uh, Michigan and Ohio were snowed out. So these self-enrolling agentless links will help you protect yourself from having to get out there in the stormy weather and put yourself at risk. You don't want to put yourself at risk ever. So that's my information that I wanted to share with everyone. Thank you. Also, you may want to take advantage of that free world-class trauma therapy that I'm giving away on the website, www.insurancemamma.com, and you'll find my free book there, also Aging Healthy. And it teaches seniors how to prevent falls with Tai Chi. And it's fun, and activity will help prolong your life. It will give you longevity. The more active you are, you'll live longer. Thank you. Bye now.